So, can a solution be found to address the healthcare crisis? And who should shoulder the blame for the stalemate? Bob and Steph are back, and we're now joined by former Liberal Health Minister Dr. Jane Philpott. Dr. Philpott, welcome. Thanks for coming in. When you were Health Minister, you were in kind of a similar position with the provinces. You were hearing the same requests for increased health transfers. Is there a way to get through this impasse now and finally agree to a solution for long-term funding?
There has to be a way to get through. This is an incredibly important conversation for the entire country. And as you said, it's similar to the situation we were in, more than 5 years ago now when we were negotiating the last time, except that it's different because we've spent the last 3 years in this extremely challenging health crisis. Mm-hmm. The health workforce is exhausted, and the backups and backlogs all over the country are so great that there is almost nothing that's more important right now for us as a country to be able to get back on our feet economically and socially than to get health care right. And so it's an incredibly important conversation, and everybody's going to have to show up at that table ready to get work done. Yeah.
Bob, this is kind of like an evergreen story in Canadian politics. I know you've covered it many times, this constant battle between the premiers and the Prime Minister over funding. Who stands to gain and lose from this debate? Because Canadians get very frustrated by it, but do they blame anyone in particular?
Well, the Canadian public is the one that is losing. Right. The system is on the very edge of collapse. Yeah. And we are having Ottawa and the provinces playing that same old game of tit for tat, fighting over money. There are solutions to fix this healthcare crisis. The medical healthcare professionals, doctors and nurses have put them on the table. Right. Ottawa needs to sit down with the provinces and say, okay, if we give you this money, tell me and commit that you are going to bring in these changes. Right. We're not going to shovel a bunch of money to you. They want the money, and we've seen this happen before. We give them money, they take it, and they cut people's taxes or they spend it on highways. Right. We need money into our healthcare system, but not just throwing money into it. We need money going into solutions. Right.
Steph, the pandemic really revealed some of the strains that the healthcare system is under, and now we're seeing these waves of respiratory illnesses affecting Children's Hospital, people reacting very strongly to that. Is that emboldening, do you believe, people who would like to see a bigger role for the private sector in Canada's single-payer system? Is privatization a solution that anyone is considering seriously?
I think innovation is a solution that people are considering, right? I mean, you definitely saw during the pandemic, for example, a move to virtual care, a way for people to be able to access health services. That's something also that's very popular, let's say, in rural communities, telemedicine. Right. There are virtual solutions perhaps to this problem, but the broader issue, right, is who is willing to have that conversation? Who is willing to be the politician that steps on that third rail of the Canadian political debate and says, okay, I'm the one who's going to step up and say, this is not working anymore. And if Canadians continue to delude themselves about our healthcare system being the best in the world because nobody has to pay for anything, we see the consequences of that, right? But getting the premiers and the Prime Minister in a room together, that's one thing. Maybe what they need to do is also bring in doctors, nurses, patients, bring them into the room. Start listening to those voices, put aside your jurisdictional nonsense, and, figure out an answer.
You're right. Do a First Minister's Conference that includes the healthcare professionals so that it puts them, the Prime Minister and the premiers on the line, because they do have solutions. Yeah.
Dr. Philpott, in 2016, you came to the table with an offer to boost funding by $11.5 billion over 10 years, but funds were earmarked for home care, for mental health, and the premiers didn't like that. They didn't like putting strings on it. And then you ended up making deals individually with specific provinces. Do you think the current government's going to have to take that route? They're going to have to put these agreements in place one province at a time, kind of piecemeal?
I suspect that it will happen one province at a time. Whether that has to actually be considered piecemeal or not is another question. I think that the days of no strings attached are over, and I actually think both the feds and the province are entering this with some good ideas, and both of them with some rigidity that's absolutely going to have to change. So yes, the feds are going to have to bring more money to the table. Yes, the provinces are going to have to say, we'll take some strings attached. We've got to be able to find some common ground on areas like access to primary care, which is a disaster across the entire country. So let's all agree that that can be fixed. I love Steph's suggestion that nurses, doctors, other health professionals need to come to the table. The patient voice needs to be there, and let's actually say we need to invest more. We need to invest better. There are solutions, and we can no longer accept the status quo in healthcare.
Bob, throughout the pandemic, the Prime Minister met virtually, I think, almost every week with the premiers collectively. Now there's this demand that he meet with them to talk about long-term healthcare funding, and he has been so far reticent to do that. Why?
Well, I think he's worried about getting entrapped in these formal First Ministers type meetings where they don't tend to be overly successful, and it's we want money, you want money. But what I'm surprised he's not doing, Glenn, is he does have a very good relationship with most of these premiers, right, as you pointed out.
Like from Premier Ford, he gets along very well with, yeah.
Why he isn't picking up the phone and having individual conversations with the premiers to try to figure out a way through this impasse, because the longer we delay, the more difficulty we're seeing with lineups at hospitals, all the problems with the pediatric care. My doctor died, I can't get a doctor. I mean, right, yeah. This is a serious issue for Canadians all across the country.
Steph, Jagmeet Singh has raised this as a possible reason to cancel his confidence and supply agreement with the federal government if the government doesn't move quickly enough to get more funding into the healthcare systems. Is that bluster, bravado, or is this something could actually trigger an election?
The supply and confidence deal when it comes to healthcare, by and large, is worded very vaguely, right? I mean, there are some specific commitments about pharmacare, a timeline on that, a dental care, timeline on that, but as the healthcare system writ large, very vague. So let's look to Jagmeet Singh and say, okay, what does he consider a win? What will he accept as, making good on the agreement? He's set forth, he wants to see more compensation for doctors and nurses and things that aren't necessarily in the federal wheelhouse. Right. I think there's wiggle room there. I think there's definitely a way to put pressure on the Liberals. But whether, Canadians are going to go to the polls over healthcare, given the fact that, it's a provincial issue as well. Right. Triggering a federal election on something you need the provincial buy-in on, it's a bit challenging politically.
Great, thanks.